Targeted temperature management is proven to improve neurological outcomes in patients achieving ROSC after cardiac arrest. This project started as part of an effort to document how frequently providers in our hospital were using the normothermia protocol order set. Patients who survived a cardiac arrest over a 3-month period were reviewed in the electronic medical record. If a patient has any neurological deficit or is under sedation, they should be started on targeted temperature management. Unfortunately, documentation of patient status was not sufficient to find a good denominator. In fact, the rate of documentation of neurological deficits with the Glasgow Coma scale or any other means among patients was near 0%. This motivated us to change our goal from increasing the rate of targeted temperature management to increasing documentation of patients' neurological status after a cardiac arrest. We could then measure the rate of TTM use. Our method was to make a new note template, which includes a section explaining criteria for targeted temperature management, as well as a mandatory space for documentation of GCS. The addition of drop-down menus for the different categories of the GCS made the template easier to use. The note template was shared in the electronic medical record with internal medicine residents. Additionally, house staff received in-person education about documentation as well as our motivation for the study in person. This was reinforced through emails and the group messaging software, GroupMe. Chart review was done over a 2-month period that included approximately 1 month prior to the intervention and 1 month after the intervention. In this chart review, we identified how many patients survived cardiac arrest, whether a GCS was documented, and whether the documentation was done by an internal medicine resident. In our chart review, we identified 21 patients who survived cardiac arrest in the period preceding the intervention. GCS was not documented in any cases, consistent with our prior reviews. In the intervention period, 33 patients were identified after cardiac arrest. GCS was documented in 42% of cases. However, when analyzing cases that were documented by internal medicine residents, documentation of GCS was 91%. Documentation during the intervention period among individuals who were not internal medicine residents was only 10%. Overall, as part of an effort to improve targeted temperature management of post-cardiac arrest patients, this study sought to identify and overcome potential barriers to improve documentation with GCS. By creating a better note template and educating house staff, GCS documentation improved from non-existent to 91% of eligible cases. Based on these results, the next step for the project is to make the note template universally available within our institution. The improved GCS documentation will allow for better evaluation and execution of targeted temperature management.